Back, Geluk Psychology is facilitating a suicide prevention march on September 7th. This initiative is supported by Suicide Prevention Namibia, the Windhoek Central Mental Health Department, and ChildLine, LifeLine. We're honored to have this evening with us Simone Fourie, a dedicated psychological counselor with Geluk Psychology, to speak to us on this event. The event aims to raise awareness about the critical issue of suicide prevention and, of course, to mobilize community support. We'll also delve into the challenges, strategies and importance of mental health awareness in Namibia, as well as the role that community and government organizations play in preventing suicide. So good evening and welcome. Thank you so much for joining us.
Thank you so much. Good evening.
As I mentioned, this initiative is an idea of Geluk Psychology. Talk to us about what inspired Geluk Psychology to organize the suicide prevention march.
Yeah, so doing this type of thing, this march, has been an idea for quite some time, but we finally decided that this year will be the year that we execute it. Because the community is such a cornerstone of every project that we undertake at Geluk, and we care so much about people. So we decided that we feel the need to really show up for people in some way and really be there for them, especially since it is World Suicide Prevention Day. And this Suicide Prevention March really is a way for us to also connect to the community, which you don't get to do every day.
That's right.
Yeah, so it's really our love of people and our love for the community and our passion for people that really inspired us to do this year.
Can you provide more details about the Suicide Prevention March that will be taking place on September 7th and what the key objectives of the event are?
Yes, so it's this Saturday. The time is running out. It's very soon. We'll be meeting at 6 a.m. at Aspenplatz Park. It's the Snyman Circle area. And we'll be walking from there until the Suiderhof Community Park, which is across from Geluk Psychology Services. And our main objectives in this Suicide Prevention March is really to bring and unite the community together in our fight against suicide, and really to raise awareness on the profound impact that suicide has, not only on its victims, but also people's loved ones as well. I think we all know someone who has been affected by suicide. We all know someone who's lost their lives due to suicide. So we really want to not bring the public and health professionals together to bridge that gap, so we can raise awareness and that we can also equip community members on what to do if they are in a suicide crisis or in a crisis situation like this. Because we have so many people coming to us with guilt, blaming themselves. They didn't know what to do, or they didn't recognize the signs in someone that they loved. So it's not just about raising awareness, it's also about empowering community members to really focus on the problem and identify the problem so that it's not too late. Yeah.
As you said earlier, communities are the cornerstone within our society. So talk to us about how you plan to engage them during this march and what activities as well as resources will be available to them.
Yes, so our plan to engage community members through this march is really to focus on support. So there will be many mental health professionals available, and all of the therapists also at our practice will be there. We'll be also participating in the march, and so if anyone needs support while we're there, we're willing to talk to them. So we really want to highlight that we are there for one another. And of course, with an encouraging conversation en route to the end destination. So at the end of the march, we plan to give a pledge to every person who participated in the walk. And this just really solidifies our commitment and that person's commitment who participated as well to fight against suicide, and their commitment to raise awareness and to continue talking about it. Yeah.
I think there can never be too much done around sensitizing, the general public on the issues of mental health, on issues such as, suicide. So what strategies do you believe are most effective when it comes to raising awareness about mental health as well as suicide?
Yes, I agree with you about that, what you said as well. I think education and destigmatization are probably the two of the most effective strategies. I mean, there's so much stigma still in our country, in our own homes, in our family members. So I really think start there and move outward. You know, we all have phones, we all have social media, or most of us do. So we have to utilize these resources, educate people on what mental health is, what are the dangers of someone who struggles with their mental health. Talk about it with our family members, our cousins, our grandparents. We can't talk about it enough. So I really think starting small can actually make a big impact in eradicating the stigma that still exists within our communities.
As I mentioned at the beginning, the Suicide March is being supported by other organizations like Suicide Prevention Namibia, ChildLine, LifeLine, also the Windhoek Central Mental Health Department. So talk to us about how imperative it is, you know, to have organizations like this support your efforts in, you know, order to make it a success.
Yeah, so as we know, there's a lack of resources available for mental health services in our country. So the more people we have supporting this initiative, the better. Suicide Prevention Namibia, they've really been beneficial in this whole process, and you know, they really focus on advocacy and awareness. The Windhoek Central Mental Health Department, they focus more on clinical and psychiatric services. LifeLine, ChildLine focus more on counseling and crisis intervention. So you see each organization or each movement has their strengths that they play to. So this just helps to reach a broader scope of people and communities, and help people get the specific assistance that they need or intervention that they need. So yeah, having a well-rounded approach in any initiative I think is beneficial, because then we all get to do something, we all play a part.
How can other organizations as well as individuals, you know, come on board and get involved to support these efforts?
Well, if you see any effort related to mental health, I think share it, tell other people about it. That's what you can do on an individual basis. You can also participate in it if you have the time, if you can. But I think, sharing something also on social media takes like 5 seconds to do it. So it's really not even a lot of effort we have to put into doing our part. Organizations also, they can do a lot, you know. They can do workshops in their own companies. They can educate their employees on what to look out for, what are the dangers. They can provide counseling services to their employees. We can do seminars. We can do presentations at schools. We can educate teachers on what to do if children show these signs and how they intervene in those cases. So there's still a lot that we can do. There's still many companies that or organizations that lack those efforts for their own people. So yeah, there's still a lot we can do in terms of workshops and trainings and just educating people.
You mentioned earlier, Simone, of course, one of the reasons behind the education and bringing awareness to the community on mental health issues or suicide is of course to sensitize them and also help them to identify the signs which they often feel guilty about after the fact that they didn't know, they couldn't see, they didn't pick up on. I want to discuss what those are. I know it's not the same for everybody, and there's so many different signs and things that you can look out for, but what are the most common things that we as family members, friends, loved ones can look out for to be able to identify that somebody we know is struggling, is perhaps suicidal, etc.?
Well, I think definitely if they are acting in a different way than what you are used to, so if they are very isolated and withdrawing themselves from other people, sometimes they do talk about death or talk about going away or not being here anymore. So it's just behavior that you're not used to. Symptoms of depression may be present as well. So sleeping a lot or not sleeping, not eating, not having any motivation to do things that they used to do, like losing interest in activities that you used to love. These are concerning signs. So these are behaviors that wouldn't normally be what the person would engage in. Perhaps also saying very negative things and talking about death. Sometimes it's as obvious as that as well, but we don't take it seriously. And I think we can never take it seriously enough, Even if someone says a few things and you might not be sure, still talk to this person and ask them what's really going on. Ask them if they're okay, because you never really know. People don't always show the truth. So those are some of the concerning signs that I would say look out for in a person who may be struggling with their mental health. Yeah.
Of course, for somebody watching this evening or is struggling or would like to reach out to somebody who they know is struggling, the 7th is a few days away, but where can they go immediately if they need some assistance, some help? Is there a number they can call, somewhere they can reach out to speak to, etc.?
Well, they can call LifeLine, ChildLine. It's 116 or 106. Either of those numbers work. They have a 24-hour toll-free counselling line, so I would say that would be a good option because they can also direct you to different places.
Yeah.
If someone is really in an intense crisis right now, so they know someone is doing something or you want to do something, people can also call the police. A lot of people don't know this, but they also handle cases like that. You can also call Suicide Prevention Namibia. Their numbers, everyone on Facebook, they're on Instagram, they're on Google. So Suicide Prevention Namibia also gives counselling services to 24 hours round. So those are resources that you can access if you're in a crisis. Yeah.
Thank you so much. Just lastly, is there a final message or call to action you'd like to share with our audience, regarding the importance of mental health awareness and suicide prevention?
Yes, I would just like to say that we should really remember to open conversations around mental health, since this is also the theme this year, to start the conversations. So I think if we can all challenge ourselves to talk about mental health with someone that we've never talked about it before this week, I think that would be good, and that would really start the conversation, because that really does a lot. It plants a seed in someone's mind, and it creates awareness that this is important. It's one of the most important things ever. Thank you. That's my final thoughts.
September 7th, what time? Where's the starting point for those who'd like to join the march?
So the Saturday, 6 a.m. at Auspanplatz Park. That's the Snyman Circle. That's across from CMC Hospital, if anyone knows where that is. We'll all meet there. We'll start the march there. We will have a police escort as well, so it'll be safe. And then we will end at Suiderhof Community Park, which is across from Geluk Psychology Services, also close to Triple J service station. We know where that is. How long the walk will be, that will be how fast we walk. How fit we are, it will depend. And we invite everyone. Everyone is welcome, of all ages. If you can walk, I hope to see you there. It's free participation, no fees involved. So yeah, everyone is welcome, and we hope to make some noise regarding mental health. Yeah.
Fantastic. Thank you so much for being here, Simone.
Thank you so much for inviting me.
That was Simone Fourie from Geluk Psychology speaking to us about the Suicide Prevention March initiated by Geluk Psychology, which takes place on September the 7th, and the theme is Start the Conversation. If you're able to join, you can go onto their social media pages to get all the details if you've missed that, and be a part of this for a good cause. We'll be right back with more conversation after this. Stay with us.